Welcome to today's Nurse on the Go video. Today we're going to talk about female catheterization. It is a very embarrassing topic for the patient because it's quite an invasive procedure. So you have to tread carefully and explain exactly what you're going to do to the patient, explain that there will be a funny sensation, and keep their dignity at all times because it is quite undignifying what we're going to do. So first of all, I put a sheet over the patient. Because we're doing a female one, we'll get the ladies, if they could, to bend their knees up and flop their knees out if they're possible. If they've got any hip injuries or pelvis injuries and they can't do that, you're going to have to get a second pair of hands to help you to gain access, because it is going to be quite hard because their legs will be in your working environment. So first we prepare our site. So I have a catheter pack that has a couple of kidney dishes, some forceps. For females, choose a 12 to 14 French IDC, that's about normal size. And then we put a bit of chlorhexidine and we have some water to blow up our balloon. So before we start, we check that the balloon works on the IDC. So we check that the water goes in and out and stays in, hasn't ruptured, and that we have everything ready to go, because once you start, you're going to need everything ready to put in and not fiddling around trying to get other things going. So we do what we do first. So after explaining to the patient, so we say, Betty, I'm just going to give you a quick perineal wash. So we expose the area, all right, but try and keep the rest of her covered. And we do it's not a non-sterile wash first, so we just want to clean the bulk of the bacteria away and debris, so we're doing the heavy work. So we start with the outside labia, start at the top and work your way to the bottom, never from bottom to top, because you'll just recontaminate with fecal content. So top to bottom, start with the outside, okay, throw that wipe away, get a second one, and then go on the inside of the labia, both sides, give it a good wipe. Alright, done that, I'll go away, I've chucked away my stuff, I'll put that away there. Go and do a surgical hand wash, come back, put on my surgical gloves, my sterile gloves. Okay, now I use two sets, because I use one for cleaning, then I put them away, and then I use a set underneath to insert the catheter. Alright, so I've got my gloves. Now while I'm sterile and clean, I haven't touched anything, I've sneakily put my water underneath the dressing tray, so I don't touch it. Because I'm touching the sterile field and not the actual water, I can insert the syringe, squeeze out 10 mils of water. So if you've got no one to help you, that's a good thing, good little trick. So there's my water ready to go. So now I take over my little bundle. I have a nice little bluey underneath, and then I just get my chlorhexidine soaked cotton balls and start at the top and just work my way down. So one swab and then discard, two swab, discard, and keep working on the inside until it all looks quite clean and you've got rid of any debris and mess. Okay, so once you've done that bit, this is where I discard these. I'll take that tray away too. I'll discard my outer gloves, keep my inner ones on, discard those, get my drape. So, and then a lot of drapes don't have a hole, so you just pinch a little hole in the middle. You want to try and keep it sterile as possible around the outside. So try and get a little sterile drape going. And then I use the other drape because you want to try and keep a big sterile field. I'll put that underneath there. Put my kidney dish that's sterile there. And I'll also, if you need a specimen at the same time, this is the best time to get it sorted. So get your little specimen open, ready to go. And then I get my catheter bag and put that all at the end. So you've got the legs out to the side and you're working up the middle. I'll grab my catheter. Okay, so I've checked it, I've primed it. Now it has a little seam that you can split, so you don't have to actually touch the catheter. So you can split the seam, all right. Some people use tweezers. I just find that's too fiddly for me. I just try a non-touch technique. So I put the end of the catheter in some gel just to keep it lubricated. All right. Spread open the labia and look for the urethra. Now at the top you'll see the clitoris, and then it's sort of arc back down, and then you'll see a little hole, and that's what you're aiming for. And then you gently insert your catheter in. Now you don't have to push too hard, and because the woman's urethra is very short, you don't have to, it will be in the bladder very quickly. Put the end of your catheter into the container, otherwise you'll get urine everywhere, and that's just more mess to clean up. And gently, as you're inserting, holding the plastic, just push and then pull the blue striations off until you get urine. And then once you get into the bladder and you get urine, so it'll be filling up into the catheter there, and is that going? And then you'd fill up your urine in your little specimen here, and then connect your catheter bag straight away without tipping over urine. That's not a very good look. And then this is where we fill up the balloon. So we fill up our balloon. So usually markings on the side tell you how many mils. So this is 10 mils. So put 10 mils in. Gently pull back the catheter until you feel it stop. Okay, so until you feel a bit of tension, because that means it's sitting in the bladder neck nicely. And then take away everything, take your sample away, and then we get a bit of securing tape. So we take all that away, chuck all that out, get rid of all that, and we secure it to the inside of a patient's leg. And if they've got fragile skin, there's a variety of fixation devices to use. And just watch and make sure that urine is coming out into the bag. And if you find that they're getting over, say, 500 mils, I usually clamp it off about there. Give them 15 minutes and then let another 500 mils out, just slowly, just so their bladder can reduce slowly, not too quickly. So today's lesson, we always keep the patient's dignity, explain the procedure to them. We use a non-sterile wash first, then we set up with 2 sets of gloves and a sterile procedure. Gently insert the catheter, either a size 12 or 14 is preferable. Have everything ready to go all at once. Have your sample pot ready, and then insert your catheter, put your bag on and secure it as needed. So thank you for watching Nurse on the Go video. I hope that was informative.